Welcome back to the Moein podcast. I'm your host, Liza, and you're listening to episode 5 of our series where we sit down with Dr. Moein to discuss everything related to cosmetic and reconstructive surgery. Today, we're focusing on a topic many women are deeply curious about: breast augmentation. From implant types and sizes to recovery, risks, and cost, we're breaking down everything you should know before choosing this procedure. Dr. Moein, welcome back to the show.
Thank you, Liza. It's great to be back for episode 5, and I'm looking forward to helping women understand this procedure with clarity and confidence.
Let's start with the basics. When someone says breast augmentation, what exactly are we talking about?
Breast augmentation is a surgical procedure designed to enhance the size, shape, or overall appearance of the breasts. Some women choose it because they want their body proportions to feel more balanced. Others want to restore volume lost after pregnancy or weight changes, and some simply want to feel more confident in their clothing. It's not about looking artificial, it's about enhancing what's already there in a way that feels natural and comfortable.
Why do you think so many women consider this procedure? What are the most common motivations you hear?
The reasons are very personal. Many women say they've always felt their breasts were smaller than they wanted, and even though they are confident women, they still wish for a bit more fullness. Others come after breastfeeding and feel their breasts have deflated or lost shape. Some women have one breast larger than the other and want symmetry. What's important is that the motivation comes from within, not pressure from society or anyone else. When done for the right reasons, the confidence boost can be incredible.
Now let's get into implants, because this is where most people get confused. What types of implants are available and how are they different?
There are 2 main types of implants, silicone and saline. Silicone implants are filled with a cohesive silicone gel that feels very similar to natural breast tissue, which is why most women prefer them. They tend to look and feel softer and more natural. Saline implants, on the other hand, are filled with sterile salt water. They're inserted empty and filled once in place, which allows for slightly more flexibility in volume adjustments. Some women like them because if a rupture occurs, the saline is safely absorbed by the body. But overall, silicone implants remain the most popular choice simply because they provide the most natural feel and appearance.
And what about shapes? People hear round, teardrop, high profile. It gets overwhelming quickly.
Absolutely. The shape of the implant plays a big role in the final appearance. Round implants give a fuller, perkier look with more volume in the upper portion of the breast, which many women love because it creates that youthful contour. Teardrop implants, sometimes called anatomical implants, are shaped more like a natural breast with a gentle slope. And they're great for women who want a subtle, natural appearance. We also consider the implant's profile, which refers to how far the implant projects from the chest. Some women want a very natural projection, while others prefer a more defined, prominent look. It all depends on the woman's anatomy and her aesthetic goals.
One of the biggest questions women ask is about size. How do you help a patient choose the right implant size?
Choosing the right size is one of the most important parts of the consultation. Instead of thinking in bra sizes, implants are measured in cubic centimeters or cc. When I help a patient choose, I look at their chest width, their existing breast tissue, their skin elasticity, and their lifestyle. For example, athletes often want a moderate, natural size that doesn't interfere with activity. Other women prefer a fuller appearance that enhances their curves. I also use 3D imaging, which allows patients to see how different sizes will look on their body. That makes the decision much easier and much more accurate.
Another concern people have is scarring. Where are the incisions usually placed?
There are a few different incision options, and the choice depends on what will give the best result with the least visible scarring. The most common incision is placed in the crease under the breast, where it heals extremely well and is almost invisible over time. Another option is around the lower edge of the areola, which creates great camouflage but isn't always recommended for women planning pregnancies. Third option is the armpit incision, which leaves no scar on the breast itself, but is a bit less precise. Regardless of the chosen method, the incisions are very small, usually only 3 to 4 centimeters.
And once the incision is made, where is the implant positioned? Over the muscle or under the muscle?
Implants can be placed either over or under the chest muscle, and the choice is based on the patient's anatomy and goals. Placing the implant under the muscle is the most common because it creates a very natural look and reduces the risk of rippling. It also provides better imaging during mammograms. Over the muscle placement is sometimes used for women who already have a good amount of natural breast tissue because the tissue provides enough coverage for the implant. Both techniques can look beautiful when chosen correctly.
Now there's also fat transfer breast augmentation, where no implant is used at all. How does that work?
Fat transfer is a wonderful option for women who want a very natural, subtle enhancement. During this procedure, we take fat from areas like the abdomen, flanks, or thighs using gentle liposuction. We process the fat and carefully inject it into the breast to add volume and improve shape. The results look incredibly natural because it's the patient's own fat. The only limitation is that fat transfer usually adds a moderate increase in size, generally about half a cup to 1 full cup per session. So it's best for women who want a soft, natural look rather than a dramatic change.
Let's talk about recovery. What can a woman expect after breast augmentation?
Recovery is usually very manageable. Most patients return to light activities within a couple of days and feel comfortable enough to resume normal daily routines relatively quickly. Full workouts can typically resume after 4 to 6 weeks. There's some tightness and swelling at first, but that's completely normal. As the implants settle and the swelling subsides, the breasts begin to look more natural. Many women tell me they're surprised by how smooth the recovery is, especially compared to what they were expecting.
Are there risks or complications women should be aware of before making a decision?
Every surgery comes with some level of risk, and breast augmentation is no exception, although the complications are rare when performed by an experienced surgeon. Some possible risks include infection, implant rupture, capsular contracture, or asymmetry. There are also long-term considerations like the fact that implants are not lifetime devices. Many women may choose to replace or revise their implants at some point. What's most important is having an honest conversation during the consultation so the patient understands both the benefits and the potential risks.
And of course, the big question, cost. What's the price range for breast augmentation?
The cost can vary depending on the implant type, the surgical technique, and the city or region where the procedure is performed. On average, breast augmentation can range from around $7,000 to $12,000. This typically includes the implants, surgical fees, anesthesia, facility charges, and follow-up appointments. At my practice, we make sure patients understand every part of the pricing and offer financing options to make the procedure more accessible.
Dr. Moein, before we wrap up, what is the most important advice you would give a woman who's considering breast augmentation?
The most important thing is to be clear about your goals and choose a board-certified surgeon with extensive experience in breast procedures. Look at before and after photos, ask questions, and make sure you feel comfortable with the surgeon's approach. Good consultation should never be rushed. It should feel educational, supportive, and tailored specifically to you. When the decision is made thoughtfully, the results can be life-changing.
That wraps up episode 5 of the Moein podcast. I hope this conversation helped answer the questions so many women have about breast augmentation. Dr. Moein, thank you again for sharing your expertise.
Thank you, Liza. And to everyone listening, if you're considering this procedure, gather information, choose a qualified surgeon, and make the decision that feels best for you. Our surgical team will be honored to support you every step of the way.
We'll see you in episode 6. Until then, stay informed, stay confident, and thank you for listening to the Moein podcast.